Okay, very good. So welcome everybody to the weekly seminar on mathematics modeling of COVID-19. Today we have a speaker, Tom Hurd from McMaster. He's going to speak on the title you see there. It's going to promises to be a very interesting talk. Thank you for joining us. What I suggest is that if you have questions during the talk, enter them in chat, and they will be moderated at the end of the talk, and then Tom will be happy to converse with you on your questions. Okay, good. Tom, please.
Oh, great. Well, thank you, Jian Hong and Kumar, for inviting me to speak. This is a great opportunity for me. I've got a little team going on this project, Hassan, Weiji, and Vlad. So hopefully they're listening in right now. I'm not sure what kind of audience I have out there, but I've sent out messages to friends and colleagues and encouraged a wide audience. So I'm going to try to keep this accessible. In the middle, there's going to be some math, but at the beginning and end, hopefully there's some interesting epidemic ideas. So, oh, I thought this was going to advance. So I'm one of the co-leaders of the Field CCOM Systemic Risk Analytics Lab, along with Sebastian Jaimungal and Matthias. And so we were sort of instructed to look at emerging risks around the world. And so COVID absolutely is an emergent risk. I was inspired, background, in 2009, and this week in April, I started doing network science because of the financial crisis of 2008. So there was an event this week in Toronto that inspired me to carry on working on systemic risk in finance. And so that led me to write a book called Contagion, Systemic Risk in Financial Networks. I did much of this work in Zurich with Paul Embrechts and Mario Wittrich, who maybe are listening here. With a name like that, I couldn't not think about COVID seriously when it sprung upon us. So what are the goals of the project? There's a style of epidemic modeling called agent-based models. So part of the aim was to have a class of agent-based models for infectious disease. But that's not really where it started for me. It started in point 2 with this idea of a very large population. There should be some analytic approximations to agent-based models. So this is an idea that has been pervading network science, and in particular in financial networks, we've been using these ideas. So then when you have these two ideas, you need to put them together, and that's going to require a huge amount of testing to see whether everything's consistent. So you want to be running your agent-based model, and then you want to be running your n equal infinity analytics, and they're supposed to be talking to each other and consistently giving you the same messages. So a huge amount of computer testing to make these things fit together in an understandable way. But what's the end result? Hopefully, 4 is the biggie. Having this robust system involving agent-based models and a suite of analytic formulas that can predict what the agent-based models are going to tell you before you run the agent-based model seems like a really powerful set of ideas. And so using these tools, we should be able to investigate all possible policy interventions that you'd want to think about to rein in COVID-19. So it sounds ambitious. So let me just motivate everything. I have this example. My mother lives in a seniors residence. She's very healthy. It's in a town of about 10,000 people. There's 100 residents in this seniors residence and 50 workers. So could the management, what kind of strategy would the management undertake to prevent infection of the residents? Well, there's got to be some serious social distancing in the residence center. But if the disease takes off in the town, how can they hope to avoid an outbreak inside? Well, unfortunately, according to our agent-based model, with a strategy that seemed plausibly strong, they didn't succeed. So here's a graph of the agent-based model for exactly what I described. So a town of 10,000 people, 100 residents of the center, and 50 workers. And this graph just came out yesterday, and Hassan gave it to me, and it tells a lot of stories. So if you look at it, there's the red curves are the active infected people, and so the contagion started before time 0 on this graph to the left, but eventually it built up in the town, and you can see the very first, I don't know, is my pointer visible? Yeah. So the first peak is the contagion raging in the village, in the town. And due to the efforts of the management to keep the disease out, they managed to postpone the disease for about 20 days. But eventually the floodgates are open and the workers bring the disease in, and eventually basically all of the residents, the seniors, end up getting the disease. Now, just as a mathematician, you see the first curve is very smooth, but these other curves are very jumpy. Of course, there are only 50 workers, and the middle curve is showing you exactly when the individual workers are getting the disease. And then the last blue curve the blue curves are the recovered or removed people. Unfortunately, that would include any deaths from COVID. But so you see the second and third blue curves are very, very jumpy because we have small numbers. But you see the regularity of the contagion in the village is because we have almost 10,000 residents. And so our large N analytics will very skillfully capture the smoothness of the village, but it also captures much of what's going on. This is the analytical approximation with exactly the same parameters. So the first peak, it very accurately matches the peak on the agent-based model. So, but with an agent-based model, it's sort of fun to play around with because you can do forensic analysis. And so this gives you some idea that we're really talking about the details of a simulation of the disease. And this just shows, if you look from right to left, the first resident to get the disease, that happened on day 79. And you can work backwards and see who they got the disease from. And this person, 4,892, was a worker who got the disease from a villager, who got the disease from another villager, and so on back to the first infected person back on day 0 of the epidemic. So with an agent-based model, you can probe the details of how the infection plays out. So in the title, I talk about inhomogeneous random social networks. So let's just go forward, try to speed up a little bit here because it's going to start getting mathematical. This is mathematical modeling. So we have a random network of individuals. The people are classified by types like age and profession and the city that they reside in, and all of these things can be part of the type classification. Now we want to model the health of the individuals, and we do that by a number called the immunity buffer, delta. And then we also want to model what happens when an infected person meets a susceptible or uninfected person. Well, if they get close, they're going to transmit a viral dose to the uninfected person, and that's given by capital omega. So try to remember that delta is the immunity buffer, how healthy we are, And omega is the amount that an individual transmits. W will transmit to V if W is infected. And so any individual in our agent-based model becomes infected as soon as the sum of the exposures of their infected contacts exceeds their immune buffer. So that is the underlying basic mechanism. Okay, so let me just throw this up here. So I wrote a paper, I'm still working on it, on inhomogeneous random financial networks. And blah, 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 I won't bore you. It's a very technical work, was really, really, really hard. But basically it boils down to modeling a contact, the contact or the connections between banks. Now, what's really important is that banks are very complicated things. So here we got a network of very complicated objects. Well, human beings are complicated as well. So, you know, we've been thinking a lot about networks of very complicated structures. But it boils down to a graph that connects all the agents. And then level 2 is giving balance sheets for the banks and the interbank exposures, which we call omega. Now, you can look for yourself and find that paper, but very recently, I just, well, this is more or less the same words. The only words that change are the financial networks become social networks and banks become people. And instead of balance sheets of banks, we have immunity buffers of individuals. So this paper I put up about 3 weeks ago on the archives. So it's brand new. So what I didn't emphasize in the paper that I just posted is the agent-based point of view. And I think actually the agent-based point of view is where to start when you're a mathematical modeler. So what is an agent-based model? Well, it's a computational scheme. You can implement it on a computer, but you can't do any, you can't do paper, paper, pencil, and pen calculations. But basically, multiple individuals are endowed with characteristics. They interact with each other and with the environment according to predefined rules. So I gave you an example of that with my seniors residence model. Okay, so what is the agent-based model that I showed you? Well, a bit more detail. So I said we have individuals that are endowed with types, and there's capital M different types that includes characteristics like age and profession, the city that the person lives in, the country they live in. Now, M can run on my laptop, can be 10,000 on my laptop. But in addition, we want to track the disease. And so individuals move through the stages of the disease, which are here in our sort of run-of-the-mill model. They start as susceptible, that means not yet infected, then they become exposed, then they become infective, in other words, contagious, and then finally they either recover from the disease or die in this. So this is called the SEIR type classification. So just so that we have something to concrete, I'll tell you what the parameters are in my agent-based model. So there's N, the total population. There's capital M, the number of types. And we endow these are probabilistic. So we know the fraction of the population that's in each type. Then a very important ingredient is the social connectivity matrix. It says that maybe 60-year-olds tend to meet 50-year-olds for an hour a day. And so there's a lot of research worldwide on social connectivity, and for us it boils down to an M by M matrix. There's another parameter which will come up, it's called infectivity. We need to describe how individuals' immunity buffers and what they look like, and so we need parameters for that. We also need parameters that say how much virus they tend to generate. This is called shedding. You know, when infective people, they shed virus to the people around them. And then the only other parameters are transmission probabilities from class to class. So we start the model off, an individual run of an agent-based model. We have n individuals. We assign types at random to the individuals. We build a social contact, in other words, a friendship or contact matrix telling exactly which individual meets which other individual. So that's a big, huge matrix. And then we endow the individuals with random levels of immunity, that's the deltas, and we endow every friendship link with an exposure, which is another random number. And so that's called capital omega. And then finally, we decide who's initially in which of the four classes. So basically, we start the contagion with almost everybody in the S class, and then we throw a few people with the disease at random into our agent to get it started. And then we just turn the computational crank on the computer. We generate lots and lots of random numbers according to the rules, and then we find out what happens. So, well, I can. So, in more detail, so the contagion, we're going to measure it day by day and count the number of individuals in all of the classes of the disease. So the infectives, we're going to assume this probability Z that each of their possible social contacts will be met. So one at a time with probability Z, you look through this infected person's social contacts and you say, yes, they meet this person and they meet this person and this person, but these other people, they don't meet. But whenever they meet a susceptible social contact, they transmit this viral load. And this is all done in our computer simulation. So when susceptibles become exposed, they move into the class E, they become exposed when the cumulative viral load they've received exceeds their immunity buffer. And then once they're in the exposed class, then some of them become infective, moving into I. Some of the infectives every day will recover or die, called removed, and be put into the final class, which is R. Okay, so that's the deal. So this is now where you start mathematizing or putting mathematics to the whole thing. I'm identifying here in this slide, and maybe it's not that interesting to read the fine print, but you have to generate all these random objects, the types of the individuals. You need to decide who's connected to whom. So that's part 3 here, the Bernoulli random variables. That's just a 0 or a 1 for each pair VW, and the 0 means they're not connected, and the 1 means they are connected. And that's where the social connectivity matrix comes in. That tells you the probability. And notice it depends on the types of the two individuals. So you get a different probability depending on the age or profession of the people involved. Okay. Now, the key idea is that social networks, if it's a global network, then we have a very large number of possible contacts in the world, 7 or almost 8 billion potential social contacts. But of course, in our real lives, we only have, you know, some hundreds or maybe 1,000 social contacts. Okay. Okay, so here, turns out what I just described has wonderful mathematical properties. So this is the only theorem I'll mention. In the n goes to infinity limit, you can work out the probability that an individual has exactly 100 neighbors. And it turns out that's a Poisson distribution. Okay. So this Poisson structure is very core to the mathematics that's going to work really well. And so the mathematicians, be warned that this Poisson property is embedded in it's the reason why everything works so well in the big mathematical model that I'm going to touch on. So how's the time going here? Okay, I think we're doing fine. Without anybody to look at, I find I'm probably going quicker than I thought.
You're doing well, Tom.
Okay. Okay. So Kumar, maybe there is a question or two on the chat, and could take a break, and I could get some feedback if you wanted, if there was any question.
At the moment, I'm not seeing a question.
Okay.
Maybe can interrupt you with one question, or actually a comment. So you draw, is okay, Kumar?
Yeah, please, please.
So you draw the analogy between the bank and the individual person. Actually, in a larger province like Ontario, we have a large number of homes, residence homes. So there is a tendency, there is a desire to actually treat homes as individual agent. So it's something analogy to bank. So I just want to mention this. So there's a potential that actually the framework you're developing could be applied to more general setting instead of treating each individual, but just treat a cluster of individuals like a home, or even to like a class of students if we're talking about control the transmission in the school.
Thank you, Jihan. Yeah, I'm very sympathetic to what you just said. And it's right here on the screen, we see this kappa matrix. And the natural labelings of type are very, very hierarchical. So we could have a network of cities, and then within each city, of course, we can have a whole number of subnetworks. And it's very interesting to try to think how to efficiently capture the hierarchical nature of social structures in this kappa matrix. And I'm sure there's a great literature on kappa social, which would reflect exactly what you're saying, that, you know, a community within a larger society should be thought. So we can have a network of communities, and each community is itself a network. And so that is very, very amenable to the structure of my model.
Tom, there's one other question from Victor Zerkowski. Victor, do you want to ask your question?
I'm not so sure Wiki can allow to, oh yeah, okay, good.
Yeah, the question is if these parameters are observable or measurable in the sigma algebra generated by the process, or estimable somehow from them.
I think, of course, this is the biggest open problem ultimately. Very specifically here, I just mentioned the kinds of parameters we need. The most radical part of my model is that I need parameters for immunity buffers, or, well, you'll see at the end that the meaning of these things is pretty flexible, but we need some idea of the health, the statistical properties of people's health and how they respond to random exposures of virus. So it's kind of a novel way that's in the literature now, that the viral load, getting a very heavy load from a severely infected person is a lot worse than getting a viral exposure from somebody who doesn't really exhibit a lot of symptoms, and getting parameters for that is going to be really tough. So you're right that that parameter estimation is going to be the big difficulty. Other parameters like the social connectivity, we actually have large amount. We have large. I was very happy to find, archives of social matrices. So some of this stuff, some of this parameters are accessible to us. Others, we have to wait for expert opinion. Thanks. Okay, so I'm going to move on. So this is a little bit more how you could view the world itself. So I think because we have types not really worked out what they should be, Jianhong said we should think of networks of networks. So we can amalgamate country models into a world network. And then within a country, we can classify people. And this slide sort of gives you some idea how you can determine some of the parameters of the model. You just count numbers of people in different countries that have the different age characteristics. So the Canadian Stats Canada census data, you see there's a very rich data on counting people, demography. Now the social connections, again, there's actually a surprising literature on social exposures. So these actually make it quite amenable to get many of the parameters of the model. But you see, I've got a pretty grand view. I'd like to do the COVID model for the world. And I would invite every country in the world to classify their own people and give data for that. And now we should be able to efficiently model cross-border infection and things like that. Okay, so so that was actually what I call level 1 data, which just tells you about the social connectivity of this network of people. What I call level 2 is you endow all the individuals. In our agent-based model, literally, you've numbered 10,000 individuals and you give them all their immunity buffers, delta, and you give every link in the connection graph, the graph that I'm asking you to visualize because I didn't print out a picture of a graph, but you visualize graph. Every link is assigned an exposure, which is omega. And in an agent-based model, you're drawing random numbers for these variables, and so you need data to specify these random variables. Well, these will be probability density functions for the deltas and probability density functions for the omegas, and then the secret sauce in this is to use Fourier analysis, what they call in probability theory characteristic functions, which amount to a Fourier transform of these functions here. So your data is that were missing, and the question was, where do you get data to inform the model? Well, the really hard thing is to determine these functions. Okay, so just in the slides as they flash by, you're going to see things labeled by omega and by delta. So keep in mind, omega are exposures, characteristics of exposures, and the deltas are the immunity buffers, how healthy we are. And okay, so mathematically now, the agent-based model works with specific rules. The rules involve generating random numbers. But in addition, I'm going to analyze them as a probability theorist and see what happens. So the very basic infection transmission mechanism. So we want to know on day T, yes or no is, okay, so let me just say that this is the SI version. So I'm ignoring the E class and the R class, just to focus on going from not people without the disease to people that have been infected in the I class, okay? So essentially, we just need to know yes or no for all the individuals on day 10, on day T, yes or no, does this individual have the disease or not? So equation 1 here generates the answer 1 if they're infected, and it generates the answer 0 if they're not infected. Okay, so now their state on day T influences through these infection shocks transmitted to their neighbors. So here's an agent W, a person W, and if they're sick, they will give an exposure omega WV to any of their social contacts that they meet on that day. So equation 2 here says that if D is 1, then W has the disease. If they connect to V, which is what A and Z are telling you, they have to be 2 switches turned on. A is a switch. If it's turned on, that means they're socially connected. Z is yet another switch. If that's turned on too, then yes, they meet on that day. And so yes, SVW or SWV is a viral load that V gets from W. So you see, we're working at that level of agent by agent. And so now V sums over all of the people in the world. W is an unrestricted sum, but of course, only social contacts will actually deliver a shock. And then what we do is we just take the original immunity buffer at the start of the crisis and we subtract off all the accumulated shocks that they get from their neighbors. And that gives us kind of the residual immunity buffer. And this is calculated now 1 day later on day T plus 1. And remember, the rule is that on day T plus 1, if this is negative now, they will now be a new infective, right? Supposing that they were not infected on day T, if this new delta is negative, then they are infected the next day. So the wonderful thing is, in network science, is a whole body of work called locally tree-like independence. And it's a very powerful idea, and it works as theorems and as rigorous results in a large number of contexts, but basically it's got a higher logic. And so that's why this result is a conjecture. It's because I haven't actually got as far as trying to prove it, really. in the way that I've described, but I know from my experience that it's true. So, so basically, it's an iteration. It tells you how, when you have an enormous network where n is essentially infinity, how to work out the probability laws for every day of the contagion. And basically it works from day n to day n plus 1. And so as long as you know how to get from one day to the next, and you know where you start on day 0, then you just run through it on the computer and it generates everything you want. Now these are explicit formulas, that's the important thing. But basically it tells you, if I know what these key formulas are for day n, then you just do a quick and dirty computation to get formulas for the same object the next day. And it's expressed in terms of these characteristic functions, which are Fourier transforms of the probability density functions. Well, with a little bit of more explanation needed, but I guess, but what you see, k here is a variable, a real number between minus infinity and infinity. T is just the type of the individual we're looking at. And basically all you need to know is this gives us complete information of whether they're sick or not, and also how immune they are on day n plus 1. And it's written in terms of how they started on day 0. And this exponential tells you all about the shocks that they accumulate in the days leading up to day n plus 1. So, now there's an object here, R, which I call the Cascade kernel. It's here the specific combination of the underlying data that we input at the beginning of the model. And so this formula is, I think, unique. I've never seen it in the literature. It's contained in that finance paper, but I talked a lot about it as a finance talk, and nobody ever pointed me anywhere in the literature a formula that really looks like this. I can say to the probability stochastic process people that this exponential is the thing in the exponent is the log characteristic function of an infinitely divisible random variable, which for the technical people, it is a compound Poisson distribution. So I promised you that the word Poisson would permeate the mathematics. And so this is a compound Poisson distribution. So this conjecture, I think of it as a theorem not yet proven. It's proven in many, many simpler examples of networks. But this provides you with the means to do amazing computations. The reason why it's true is simply that you look at the detailed, the sort of most important part of the step to go from step n to step n plus 1. And you see these are random variables, and on the right-hand side, you just look and see what these random variables are. And you notice if the network was a tree, then with no cycles, you imagine a network that there's no loops in it, then we'd call that a tree, naturally enough. And so if this skeleton is a tree, it just turns out that all of these random variables on the right-hand side are conditionally independent. So, and what that means is that what would be an approximation in a general network is in fact an exact statement if the network is a tree. And then the other ingredient is that the kind of random graph I'm talking about becomes a random tree as n goes to infinity. So the conjecture relies on that logic, and that's kind of standard logic of network science. It's called the locally tree-like independence property. Okay, so time is good. So that's kind of the math, and it's very schematic. I know I jumped over a lot. So let me just, in the last few minutes, just go back to the senior residential center and give you a little bit more, more about that story, because I think it's an interesting story. So here on one page, this is the complete list of numbers that you need to input into the agent-based model to get a run. And so basically a lot of these are probabilities, and so you end up drawing random numbers with these probabilities. The kappa here, remember, kappa is a square matrix, and it tells you about so what I show here are the numbers of people. A resident will see 4 other residents in a day, and we'll see 10 social workers in a day. A worker will see 5 residents and meet 5 other workers. I think that's roughly it. I'm not sure about, oh yeah. An outsider, a person not working in the center, will see only 0.02 workers. That's because there's an awful lot of people in the village that don't ever see a worker. But then within the town, outsiders meet 14 other outsiders in a day on average, right? So that's what these numbers are telling you. And now I said that the thing that's kind of unknowable to us at the moment is how to measure immunity and how to measure viral exposure, in other words. But these are just the means of the immune buffers. I'm sorry, these are omegas. These are the means of the exposures, and the sigmas are the standard deviations of the exposures. And the mu delta is the mean immunity buffer, which I just guessed was 8 for a senior, 12 for a resident, for a worker, and 10 for an average person in the village. And then I give standard deviations for these same things. So these things are all distributions. Okay, so I just thought on one slide you can show all the parameters for the model. And so I have a little story that the management is trying to make the residents do social distancing, and they made 0 contact between residents and outsiders. There's no contact between residents and outsiders. So unfortunately, with these parameters, as we know, eventually everybody, it's a bad pandemic and there's no control in the pandemic in the village. So okay, so maybe this is not the slide to show first. Okay, so let's just look at this slide since it is next. There was one remaining parameter that I didn't talk very much about. It's the third one here, Z. And Z is taken to be 0.15. it's telling us the probability that any of our potential social contacts we will actually meet on that day. So, so I told you about these numbers. These are the social contacts. I think I have to, yeah, I kind of misspoke that, because we're only going to actually see 15% of these individuals. We're not, those would be infective interactions. So the Z parameter is a free parameter that I don't really know. And so I plot the disease progress as a function of that Z parameter, which in the end I chose to be 0.15. And this graph really shows what the aim of policy is during a pandemic. So imagine that we've arranged that the network is out here, that the infectivity parameter Z is 0.15. It means that at the end of the pandemic, everybody, including the residents and the workers, gets the disease. This is the final contagion fractions of everybody who is eventually removed and eventually has recovered, meaning they actually had the disease. And you see the remarkable thing that is, if we had been able to make the Z parameter as low as 0.06, we would see that the disease didn't start in the first place. And if we had managed to get this connectivity parameter below 0.06, we wouldn't have had a problem. So, and notice how sharp the break is between no infection and a full-blown pandemic. There's a threshold, and this threshold is characteristic of n equals infinity. So it becomes a very clear-cut yes or no thing. Will the disease become a pandemic or not? And that's one of the reasons why I really like the n equals infinity analysis. So now, you've heard, probably everybody has heard by now, of R0 for COVID. This is the basic reproduction number for COVID, is about 2.5. And basically what it means is, if you can reduce social contacts by that factor of 2.5, you can turn COVID from a pandemic and solve the COVID problem. If you could go from R0 2.5 to R0 below 1, well, we can turn R0 below 1 if we could change Z from 0.15 to 0.06. That's what this graph, so that's a long discussion of what this graph shows. The final contagion could be huge or 0. There's not a lot of middle ground. Okay, back to the retirement center. This now shows, again, the analytics of the contagion. Slightly different model now, where the green curves are telling you who's been exposed but is not yet infectious, the green. And there are 3 humps. The first peak is for the outside town, and then the workers have the second hump, and the third hump is the residents. But ultimately, everybody, including the residents, is on the blue curve up here near 1. So almost everybody eventually gets the disease. So that means the management, ultimately, they were able to postpone the infection in the residents, but they weren't actually able to solve it. So a policy intervention would be, well, let's do a better job at keeping the workers segregated from the village. Let's suppose we quarantine the workers and keep them away from villagers. That's policy intervention 1. And actually that fails too. No matter how hard you try to separate the center from the rest of the village, the only thing that happens is you delay the contagion. But the actual size of the humps is not really diminished by very much. And in the end, everybody gets the disease. So you just managed to postpone the inevitable with policy one. Remember, that was simply turning off, isolating the center from the village. Of course, you can never have a perfect separation. And so ultimately what happened was one worker got the disease, and then as soon as one worker brings the disease in, it proliferates. And so it's only by putting policy 1 and 2 together. 2 is extreme quarantine within the center. So you need both a quarantine within the center and a strict isolation of the center from the village in order to defend the residents from the contagion. And so this actually works. It's extreme measures, and ultimately only 7% of the residents end, or something like that. I didn't show the end of the contagion here, but it goes slowly, takes forever to die out, but eventually only about 10% of the residents get the disease. Okay, so I think, yes. Oh, wow, I spent too long talking about that. Well, I think you can see that agent-based models are different from, they don't just generate curves, they also generate, you know, the individual links that contagion goes through, so agent by agent. This slide is too complicated. This is touting the benefits of my approach. I hope I've persuaded you there's some merit there. There are some criticisms of the assumptions. My feeling is that I'd really like to talk to epidemic modelers and immunologists who could let me know what they don't like about the model, so that I can do variations that fix those deficiencies. There is a lot of flexibility in implementing the agent-based model, and we just, as a team, we just need some expert advice. So there's definitely criticisms of what I've been doing. So the math conclusions are, just to wind up, are that there's some of these agent-based models that have, I didn't complete the first sentence, that have this locally tree-like independence compatible structure. And then you get this remarkable reduction of mathematics into essentially 2 lines of MATLAB code. That's what this is, basically. The core infection mechanism boils down to this connection matrix R and a vector f hat, and you do a matrix multiplication and an exponentiation and another matrix multiplication, and then you do some row sums in the matrix, and that's everything you need to do to compute one day of the cascade. I think it's amazing. So the math I really think is cool. The COVID assumptions, COVID conclusions. Well, I think agent-based models really provide insight that standard ordinary differential equation models of epidemics don't. And in particular, they can tell you how, agent-based models will tell you how the disease gets started in the first place. And so it's good for forensic, you know, analysis to see who got infected by whom. So, whoops, I'm jumping ahead. There are many variations on the immunology that could be implemented. The data is the biggest problem. The applications, policy interventions of a huge variety, I think, are accessible. We just don't know what to do next. So that's why I'm really thrilled to talk right now. And so please do let us know if you would like to work with us on this. If you have an agent-based model, then these computations might be a way to predict what your agent-based model is going to do before you run these large, time-consuming runs. So that was a full tour. My friend Paul just said you've done a full tour from epidemiology to finance to epidemiology, and he says, welcome home again. And so it's a nice way of looking at it. And so I thank my friends and students and colleagues for all of your interest and insight. And thank you for listening, and keep healthy and happy.
Okay. Thank you, Tom. Okay, so go ahead, John Hong.
No, I was joining you, Claude, but maybe I can just on behalf of you and the fields to thank Tom first of all for bringing a different cluster of audience that we normally don't see from mathematical epidemiology seminar, and this I think is the strength of why the seminar is held in conjunction with the Fields Institute. We really want to bring different fields for mathematics to this much needed field, and I want to thank you for that. I have one question for you in terms of your formula 4, and that's relevant to immunological buffer. That's on page 21.
Mm-hmm. Shall I take them one at a time?
Oh, yeah, here it is. So you are talking about this more of a cumulative. That you have summation, but in epidemiology or immunology, some immunologists believe this is not cumulative. So say if you get exposed to virus in the morning, if the infection is not successful, then the exposure to the virus in the afternoon, in the union time, is just independent. So this one is this accumulated. This recursive formula might be formulated in different way. Depends on your understanding about whether this repeated exposure, how to count this repeated exposure.
Okay, exactly my worries. So so this is exactly cumulative and unrealistic for that reason. We don't expect that people just get weaker and weaker over and over the days of the contagion. That is in this basic SI transmission mechanism. So that's the state of the sort of simple version of the model, which, however, there is a beautiful generalization where the immune buffer, if you think about it, it gets hit by a shock. It starts up here, it gets hit down by a day. Supposing you meet a bunch of infected people because you're a health worker, and at the end of the day, you've experienced this big viral load from different patients. And then you go home to bed and you recover. So naturally, a lot of the viral load will disappear. And then you should be almost back to normal the next day. So that is indeed the most important, I think was probably the most important variation, and I know how to do it. So,
Great.
Yeah. So this is where the immunology matters, and this is where I listen to the experts. And yeah, I want to know what you think of that.
So John Hong, could I ask, in your group, Ali is working on agent-based models, right?
Yeah, I was about to say that, Kumar. So maybe we should bring some other speakers working on agent-based simulation, but really in practice, in application. And really, the group actually is very intensely working on simulating agent-based simulation of the disease spread in the home, in the residence home, and in the hospitals. So it would be very good platform for people to interact. Yes.
So Tom, you'd be interested in talking to that group because they're doing the simulations in large scale.
Absolutely. Yeah, we're writing a little user, or hopefully a big user guide, which is basically, and hospitalization was the next target where this extreme or the severe cases go, and they're meeting medical workers. So it's perfect for this. We have medical workers, we have medical staff or hospital staff. We have a similar situation, but a different context. And yeah, I'd be totally up to talk about that.
I have a stranger suggestion, because I see a lot of people in mass finance here, in insurance mathematics, and you're going through the epidemiology, finance to epidemiology, maybe you want to think about the two primary processes, especially when thinking about reopening the economy. So is combination or consideration of infection control and the socioeconomic activities and the financial health. So you might be able to build into this consideration, actually.
Combine both of your interests.
Yeah. Yes.
Absolutely. Now, first, I have an opportunity to apologize for the complete lack of a literature review in my talk. I just decided it would take too long to give any kind of impression of the literature in all of these areas. So I just apologize. It's not here at all. Of course, the macroeconomic impact of COVID is the question of the day. And I know Alex Lipton and Matthias are actively are working on that. I haven't talked to them very much about it yet. And I'm sure our actuarial people are intensely interested in this question. And well, the whole world needs to know that. So absolutely, I'm interested in that, of course.
Okay. I think I don't see any other questions. John Hong, shall we wrap it up?
I think we should. Yeah, thank you.
Sorry, no, that's right. Can I just jump in with a small question? Well, thanks very much for a very nice talk, Tom. One big discussion is in now in many countries, especially now in Europe, also are opening up gradually, even from yesterday, today, tomorrow. There's a big discussion on herding immunity, i.e., where you reach infection percentage of throughout the time of about 50–60%. Have you looked at your models, how one can achieve that? What kind of calibration of your parameters, or what kind of dynamic decisions can lead to such a herding immunity?
Yeah, so keep in mind, through everything that I showed you, it's basically, it started at day 0 and we didn't intervene at all. So all the parameters were, so it's unrealistic. The reality is that social policy policy interventions are happening everywhere all the time. And so you have to take this kind of model and then say, you know, what happens when people improve their social distancing, when different types, different professions switch back on their social contacts. All of these questions, this is exactly what I meant by all such policy interventions can be tested, and I think very quickly in this framework. You can just go for 30 days and see where you're at, and then what policy intervention, we're now only 30 days into an ongoing pandemic, what can we do now to get to a herd immunity of 50% in the most effective way? Well, clearly you want it to take a long time to get there, or maybe you don't, maybe you want to get there in a week, but all of these things are incredibly important. I just would like to know, I think ultimately what's holding me back is that I don't really know what the immunity buffers should be for real people. And I don't know what the viral doses look like. If you're talking about a child hugging their mother, how much virus if the child is sick? You know, all of these questions may or may not be important. But at least we can see which of those assumptions impact things like what you just asked about.
Thank you.
Good. So Thanks again, Tom. Thanks everyone for attending, and we'll meet again next week. Looks like there's lots to discuss, and I'm sure there may be other questions when we go offline. But very interesting talk. Thanks again.
Just want to announce that, Kumar, so next week we'll be somebody is going to talk about more prediction and monitoring the whole situation across the country.
Okay, very good, very good. Okay, thanks everyone. Bye.
Thanks. Bye.